The Office of Diversity and Inclusion at the Wayne State School of Medicine welcomes you to the ODI Speaker Series. The ODI Speaker Series grants students, staff, faculty, and community members the opportunity to explore themes regarding health disparities, health advocacy, and health education. Our guest speakers are physicians and surgeons from across the state of Michigan with various areas of expertise. You can ask our guests any questions by completing the RSVP form in our invitations, and our guest speaker will answer your questions live. If you have any questions, concerns, or compliments for the office, please contact us via email at diversity@med.wayne.edu. For more updates on events like these, please follow us on Facebook and Instagram at WSU-SOM Diversity. If you are a Wayne State student looking for more ways to get involved, please visit our Get Involved webpage at getinvolved.wayne.edu/ODISOM. Today we have Dr. Iyantta Howell, a psychiatrist for the Common Ground Resource and Crisis Center in Pontiac, Michigan. Dr. Howell is an alumna of the Wayne State School of Medicine, and we are happy that she could join us to discuss the impact of mental health stigma in communities of color.
Okay, so the term people of color. So that is kind of a broadly used term, but generally speaking, people of color refers to any non-white minority within the US. This particular term gained a lot of momentum in the 60s and 70s during the Civil Rights Movement, and generally includes groups such as Asian Americans, Asian Indians, Pacific Islanders, African Americans, Latinx. And for the purposes of this discussion, I will be mainly talking about stigma within the African American community, because that's, the biggest minority group that is in and around Wayne State University. Okay, so stigma, simply put, is really just an unfavorable or negative attitude about a thing. It can involve negative attitudes about people, places, ideas. But in this case, it's really just negative attitudes that a person may have about either mental illness itself or someone with a mental illness. You can advance the slide. All right, so with stigma, a person is generally, looked down upon because of maybe an issue that they have. Maybe they have depression, anxiety, bipolar disorder, alcoholism, whatever it may be, but they oftentimes are avoided because of those issues, okay? And so what are some examples, some everyday examples of mental health stigma? So basically, what does it look like and what does it sound like? All right, so the first one is, what goes on in this house stays in this house. I think we all have heard that, that phrase. So basically what that means is, or the scenario is, you have a person who is in a household, so they have a family member who has a mental illness, and it's obvious that they do, and their mental illness causes just tons of chaos. But despite that chaos, no one's ever really talking about it. They're not talking to themselves, amongst themselves about it. They're not talking to people outside of the home about it. It's just something that they keep to themselves. So it's basically kind of an unspoken agreement that all the family members have. And because no one's talking about it, chances are that person who needs the help is not getting the help. Another one is, I'll just pray about it. I think a lot of us have heard that, And then another one is, the person's crazy. So basically you're labeling people, or, you can dismiss their issues altogether by saying, you know what, just snap out of it. Another stigmatizing question is, did you take your medications today? That's kind of a backhanded or indirect way of really putting someone in their place, so to speak. It's almost like reminding them, hey, there's something wrong with you. So that's not a very helpful question to ask. And then lastly, we have the uncle in the basement. I think we kind of all know about this uncle. Those of you who may not know what I'm talking about. So, this person, this uncle, usually there's this male family member that you take in. It's usually an older, male family member, usually an uncle, and he has a mental health disorder. He may have, intellectual disability, which was previously termed mental retardation, or he may have schizophrenia or a substance abuse disorder. And he's resigned to a certain part of the home. It's either in the basement or it's in the back room. And that's kind of where he lives. That's where he hangs out. And, the old adage, out of sight, out of mind. So he's just kind of back there. And the reason why the way that he's treated is stigmatizing is because, sure, he may not communicate as well as all the other family members, and he may not be able to articulate his needs, but it's very likely that he wants the social connection, right? But because he can't ask for it, it's just assumed that he has a mental illness, he's okay by himself. So what happens is he's isolated. And we all know that social isolation can actually exacerbate mental health issues. So that's just an example of that. Also, some people may accuse others with mental illness of, making up their symptoms. You're faking it, and that can also be very isolating. You can advance to the next slide. Okay, so the question then becomes, what does stigma look like in other communities of color? So, obviously African Americans aren't the only ones who have stigma within the community. Other groups, particularly sometimes Asians, obviously not all Asians, but within certain Asian cultures, they have very interesting beliefs as to what actually causes a mental illness. So this particular chart was taken from a medical magazine, or it's basically an article from a journal. And it gives some examples. For instance, some folks in Korea may think that mental illness is caused by a disruption of harmony within an individual, or by, a person's ancestors, their spirit coming back to kind of haunt you for a misdeed or from a previous sin. And oftentimes that leaves the person just without support. It makes them feel isolated and blamed and defective. You can advance to the next slide. All right, so this particular, this here is a clip that I want to include. It actually was filmed in Singapore, and it involves Singaporean citizens. But I want you guys to take a look at it because there's a lot of parallels in what's said there, as well as what's said within kind of our own communities here in America, particularly among African Americans.
You can be born perfectly rich, have a very good lifestyle, have parents who care very well for you. I don't think mental health issues discriminate against anyone of any race, gender, or social background.
Hi, nice to meet you. Please have a seat.
My name is Nicole. I'll be a moderator for this discussion.
I'm Nicholas. Today, I'm going to ask you a few questions about mental health in Singapore. What do you know about mental illness?
I just know there's depression.
How do you say that? Bipolar disorder.
The wire is not secure,
This guy is crazy, all these kind of words.
Has nothing to do with me.
Would you hire somebody with mental health condition?
I'll probably, make them work in admin side.
Keeper, cleaning, or some simple job for them.
Either they hurt themselves or they're going to hurt someone else. Then if you're mental illness, you apply for a job. But who in the right sense who really want to take you?
Would you date somebody who has a mental health condition?
Some of them will get quite manipulative. They say like, if you break up with me, I'll cut myself or I'll kill myself.
And then sometimes they tend to post unreasonable things, such as like a small thing that happened, and then they'll make a big fuss out of it.
I cannot handle. I don't know how to handle.
How would you react to, a friend or family member who's diagnosed with mental illness?
The bridging needs to be the family and not a stranger.
不是专业医生，我们可能处理不了。
If possible, I would just stay away as far as possible.
这个小最好是不要靠近他。
I didn't introduce myself fully. I suffer from clinical depression.
I was clinically diagnosed with depression. I'm living in recovery.
And I overcame it. I wrote a letter that I would like you to read out to me aloud.
"12 years is a long time to live with a mental health condition.
In the 12 years that I've been diagnosed with depression,
This is what I've learned.
I've learned that the greatest battles we fight are the ones with ourselves.
I've learned that most conversation about employment end the moment I reveal my diagnosis. I've learned that shame is something society teaches you. I've learned how to say sorry for showing symptoms of my condition.
I've learned that friends can disappear, and I will never hear from them again.
I've learned that family doesn't always know how to support you, no matter how much you need them.
I've learned that hope is a little voice that whispers maybe.
I've learned that recovery is a process. I've learned that one small crack doesn't mean I'm broken.
I've learned that I have an illness, but this illness is not my identity.
So sorry, Iyantta, for this.
I'm so sad.
Do you have any questions you want to ask me?
Okay, so I wanted to share that clip because, you know, even though that community is not African American, there are very similar thoughts and misconceptions about people who struggle with mental illness, such as those with mental illnesses are too fragile to have normal jobs, or only family should deal with a person's mental health issues, or those with mental illness should be avoided because they basically cause unnecessary problems. All right, you can advance to the next slide. Okay, so what are some reasons of why mental health stigma exists in the first place? Now, obviously, this is not an exhaustive list, but these are some common reasons. And again, particularly within the African American community. So a huge reason amongst African Americans is there's just a distrust of doctors, just based on the longstanding history in this country of folks in the US healthcare system who have really not been forthcoming and really have just violated all kinds of civil rights of African Americans in terms of the treatment of them, and we'll get into that in a minute. There's also a lack of understanding of mental health issues, what they are, where they come from, how they should be addressed. There's misinterpretation of symptoms. There's a lot of shame, self-blame, misplaced pride, and thinking, you know what, I can handle this on my own. This particular book, great book, is called Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. So this book is, it really chronicles a lot of really crimes. I would really call them crimes against Black Americans by the healthcare system. And it really explains a lot of the reluctance that you see in a lot of African Americans of seeking any form of help, whether that's, you know, through their regular medical doctors or help from a mental health provider. This book really outlines a lot of those reasons. And you can forward it to the next slide. So, you know, just to name a few of the topics that are discussed in this book, one of them is the medical experimentation that was done on slaves. And back during times of slavery, doctors would actually not anesthetize slaves because they felt that they did not feel pain. And of course, a lot of people know about the Tuskegee syphilis experiment, which took place over a period of 40 years. And the only reason why that experiment was stopped was because of a whistleblower. So basically it involved Black men being recruited to a study that they never actually was told that they were being a part of. They actually were told that they were getting free health care, but in fact they had syphilis, and syphilis is a sexually transmitted disease that if not treated is fatal, and it's a slow, painful death. So basically the researchers wanted to see how this disease actually progressed. So they watched these men basically die. And they actually didn't even tell these men that they had syphilis. So these men were actually going back and infecting their families with syphilis. So there was another issue where women in the South were actually, they would have their uterus removed, not knowing. So they would go in for routine surgical procedures and the doctors would remove their uteruses because doctors at that time felt that, you know, Black people shouldn't be reproducing at the rates that they were. So this surgical procedure happened so much that it got the nickname the Mississippi appendectomy. And this took place from the 1920s up until the 1980s. And then there was a case of the HeLa cells, which basically involved a Black woman by the name of Henrietta Lacks. And she had cervical cancer, and doctors took samples of her cells from her cervix, put it under a microscope, and found that they behaved in very unusual ways, in ways that were actually great for research. So her cells actually went on to make possible some very extraordinary medical breakthroughs, such as the invention of the polio vaccine, major breakthroughs in the AIDS virus treatment, tons of cancer research. But the thing about it was that this woman was never, she or her family were never compensated. They were never thanked. And like I said, they didn't even know, her and her family had no clue that this was even going on. It just so happened to come out. So these are just some of the examples as to why African Americans kind of don't trust the medical healthcare system, whether that's treatment for an ailment for, you know, your heart or your head. Okay, you can advance to the next slide. Okay, so there's obviously a lot of skepticism. Again, even with psychiatrists, because not many decades ago, psychiatrists would actually prescribe very high doses of very sedating medications that would really render the person taking the medications very drowsy, sleepy, just, you know, off balance. And it was just something that they didn't want to take it, and it made sense why they didn't want to take it. Thankfully now those medications have evolved to where the side effect profiles are a lot more favorable. And even when I prescribe medications for my patients, I try to use the lowest possible dose and really listen to them when they talk to me about problematic side effects, because right now there are a ton of different types of medication that you can use if needed, if one particular medication doesn't work as well as the other. So people actually want their mental health care providers to look like them, to share their same culture. But it's very difficult because there is strong lack of representation within the mental health community. For instance, of the 1 million practicing physicians in the United States, only 4% of them are Black. Of the roughly 100 and, let me see here, I believe it's 28,000 psychiatrists. Of the 28,000 psychiatrists in the US, only 2% are Black. And according to Forbes, this number is actually dwindling because most psychiatrists are over the age of 55, which means that they will be retiring soon. So for those of you student doctors out there who are watching, we need you in the world of psychiatry. It's a great field. You should consider pursuing that because there is a great need. All right, and only 4% of psychologists are Black. Okay, so that's fine. That's fine. All right, so Monica Williams, a Black, well-known psychologist, really summed up the sentiment that a lot of Black people have towards those in the healthcare system, is that she says apprehension about clashing with values or worldview of the clinician can cause ambivalence about seeking help. And this may be especially true for the many who believe that mental health treatment was designed by white people for white people. All right, next slide, please. Okay, so I talked a little bit about a lack of understanding in terms of what is a mental illness. What is it exactly? Well, it's a medical condition. It's not just an emotional problem. So just like diabetes and heart disease are medical conditions, mental illness is a medical condition, okay? And it's treatable. So for instance, you know, if you compare it to diabetes. So diabetes, particularly type 1 diabetes, is a disease because the pancreas itself, the organ of the pancreas, is not functioning properly. It's not producing the insulin that the person needs. And as a result, the blood sugars are high. Okay, so what the doctor does is he prescribes insulin, the person takes it, and the blood sugars are normalized. So very similarly, a person who has a mental illness, the organ of the brain itself there's problems there. It's ill. So the brain actually produces tons of hormones, just like the pancreas. They produce hormones, serotonin, dopamine, norepinephrine, tons of hormones. And if those hormones are off in some way, you get mental health symptoms. You may hallucinate, you may be depressed, you may be anxious. So what a doctor does in those cases is they prescribe medication that helps to regulate those issues. So it's a treatable medical condition, you know, and people suffer unnecessarily. And, you know, it's something that can be easily treatable. All right, studies have found that a lot of mental health issues are inherited. So it's no one's fault. It's no one's fault. It's not because you sinned. It's not because your ancestors coming back to, you know, give you karma. It's nothing. It's nothing of those things. Most of mental illness is inherited, although some can result from a traumatic experience, such as losing a parent early in life, being the witness of a violent act. Maybe you saw someone murdered, killed, shot, perhaps you were raped. I mean, there are so many things that can happen that can traumatize us to the point where we can develop a mental illness. But a lot of it is genetic, okay? Actually, there's an 80% heritability pattern in terms of getting things like bipolar schizophrenia and autism. Okay, and does that mean that if your mom, for instance, has schizophrenia, that you will automatically get it? No, that's not what that means. It just means that, you know, if you have a close family member, then the increased risk is there. All right, so some mental illness, you need medication for a lifetime. Some you may only need for a short period of time. But the good news is that it is treatable. Okay, all right. So another byproduct of mental health stigma is this belief that I talked about before that, you know, prayer is all you need, right? So sometimes we over spiritualize situations that really are not necessarily spiritual in origin. Okay, and what do I mean by that? So a person can have a mental illness such as depression or anxiety, and their solution is, I'll just pray about that. Well, what does that actually mean? So I'm a Christian myself, just so you guys know. I believe in prayer. I think prayer has done some very amazing things in my life. However, prayer and faith are not stagnant, passive actions. Prayer and faith involves, it's a conversation, it's dynamic, right? So you pray and ask God, for instance, to help you with your moods. Lord, help me to not cry every day. So what should happen is after you pray that prayer, you should have your antennas up. Right? So I prayed this prayer. Wow. Isn't that something? I just happened to have a conversation with someone who said something about seeking mental health treatment. Or I just so happened to see something on TV or on the internet that is encouraging me to seek help from a mental health provider. Guess what? That's an answered prayer, right? So prayer is not passive. You know, faith without works is dead, right? We all know that scripture. So, you know, a lot of times I do believe God is inviting you to be an active participant in your own treatment. So to say that I'll just pray about it and leave it there is not always, you know, effective, right? Because if you're trying to treat a medical illness with a spiritual intervention, that's not going to always work. Okay, you can advance to the next slide. Okay, so, and when I say that about prayer, I'm kind of speaking of my own personal experience with having anxiety and depression. So I actually had depression, anxiety really back in my teens, and it kind of went away. And then it came back with a vengeance halfway through medical school. So the story is I'm in medical school. First year went well. Second year went well. Very difficult, but I got through it. So between your second and your third year, you have to take your medical boards. So the way that it's set up is you have to really be intentional about when you schedule your boards, because if you don't pass by a certain date, you can't start third year on time, and you don't want to be off track, right? So what happens? I take the boards, I don't pass, and I become extremely shameful. Just, it was like my world just basically crashed. It was like the end of, it was horrible, okay? I cried all the time, every day. And then depression turned into anxiety where I didn't want to come out my house. And I was just I just felt like a complete failure. And I felt like no one understood. So what did I do? I went to my pastor and I said, please pray for me. And will you listen to me? So I just wanted to talk about my issues. So I made an appointment with my pastor. And then I made another appointment with my pastor. And then I made another appointment with my pastor. I made so many appointments with this man that at one point he said, Iyantta, why don't you go see a professional? So that's what I did. I went, I got a therapist, and just fell in love with my therapist, not literally, of course, but the work that I was able to do, and really understanding that, wow, I'm not defective. This is not my fault, and there is treatment. So because my depression and anxiety was a bit severe, I really had to get on a medication for anxiety and depression along with the therapy, and that just worked wonders. So that process, that experience, that personal experience for me really went into my decision to become a psychiatrist. So I love the field, never thought I'd become a psychiatrist, but I can't imagine doing anything else. So you can advance to the next slide. So this is pictures of me on my graduation day from medical school. Just such a joyous day for so many reasons. And I love these two pictures because I think it really epitomizes how you get through things, journeys, right? Do we make it from point A to point B by ourselves? Absolutely not. So this first picture is a picture of me and my youngest sister. And she was kind of helping me put on my graduation gear. And that is just really who she is. She's a helper. Even to this day, she helps me with so many things completely. She's an organized person. She loves to clean. I mean, she's such a help. And I really thank God for her. And then this other picture to the right is a picture of my parents, my other sister, my youngest sister that you see in that picture, and then my little nephew. And standing behind the camera, taking the picture, is my oldest sister, who again is a huge support to me. So, I would not have been able to make it through medical school without the support of my family. Absolutely, I would not have been able to do that, because the journey that I went on, they went on that with me. So that's really, the message of this talk is, if you're struggling, ask for help, receive the help. People want to help you, but you can't isolate. Okay, so you can advance to the next slide. All right, so that was one thing. We talked about misplaced pride, thinking that you can do it by yourself, you can handle it yourself. You can't handle it yourself, okay? This is a mental health issue. It's a formidable foe. You gotta really have all hands on deck, right? You pray, but as you're praying, make the appointment to see a therapist or a psychiatrist, okay? Or you can advance to the next slide. We're kind of running out of time, so I want to just kind of run through these. We talked about the shame involved. Shame is part of the stigma that keeps us stuck, okay? So there is no shame in mental illness. It's no one's fault. The good news is you can get treatment, all right? Okay, and then misinterpreting symptoms. For instance, a person can have full-blown clinical depression and not know it. Symptoms of depression, for instance, are unexplained changes in sleep, energy level, appetite, concentration. You no longer enjoy doing things that you previously enjoyed doing. You don't have the motivation to get up and go. You may have thoughts of wanting to hurt yourself. Maybe you've taken steps to hurt yourself. That's when you need to be reaching out for treatment, okay? A person who's always in the bed, can't get out of bed, it's not because they're lazy, all right? And then why is learning about mental health stigma important? Well, it's important because if you don't recognize stigma, then you can't combat it. And if you don't combat it, then you're not getting help for the mental health issues. And if you're not getting help, it can lead to fractured relationships, lost wages, increased morbidity. Morbidity is just a term used to describe the pain and suffering associated with the disease. Increased mortality, meaning, suicides, right? Suicides are on the rise. Unfortunately, it's even rising in the African American community. That had not always been the case. So the next slide kind of gives more information on that. Over 43,000 Americans died by suicide in 2018. There wasn't a lot of statistics that I could find that generally involve just African Americans, just because there's not a lot of research, I think, that is being done on that, although the research is starting to happen. One African American dies by suicide every 4.5 hours. And the suicide rate between 1991 and 2017 increased by 73% among Black adolescents and young adults. So obviously we definitely need to address that. And then the next slide just kind of gives you stats. And the take home point from this slide is that the suicide rate for non-Hispanic Blacks increased to by 8.6% from 2015 to 2016. So again, it's an issue. Okay, so how do we combat stigma? We educate ourselves by participating in activities such as this. We reach out for help. We keep reaching out for help. We support those that we know who are struggling with mental health issues. If you know someone who's struggling, don't be afraid to reach out, okay? And in the next slide, these are some good resources if you don't know really where to start. If you are a Wayne State medical student, you actually have access to free and confidential counseling through the CAPS program. The information is there. Michigan launched a Stay Well initiative at the beginning of this year in response to the COVID-19 virus. So that is actually free counseling. It's by phone, but you can access that by dialing 1-888-535-6136. If you don't feel like talking, they've even given an option for you to simply text the word restore to 741-741. You can also reach out to your primary care doctor. You can contact the National Suicide Prevention Hotline. BEAM is a great resource. It's an online community that offers webinars to help with coping skills if you're dealing with a mental health issue. The Loveland Foundation provides financial assistance to Black women and girls who cannot afford therapy. Then there's Melanin and Mental Health, which connects African Americans with Black therapists in major US cities. And then there is my email. Please feel free to reach out to me. I would love to be a resource for you. And I really appreciate you guys listening to this talk. I really, hope that you learned something. So just takeaway points: mental health stigma involves negative views about mental illness. It disproportionately affects communities of color. It can block or delay treatment. And we talked about the reasons for that, Black people's distrust of the medical community, lack of understanding of mental health issues, misinterpretation of mental health symptoms, stigma due to pride or misplaced shame, and how we definitely should educate ourselves. All right, so thank you guys so much for your time.
All right, thank you so much, Dr. Howell. Reads as, how should we as providers reassure our patients that the oftentimes prolonged wait time to be seen in the Detroit area will be worth the effort?
I can't, no one can reassure anyone of that. The only thing I would say is to reach out. If you call a place and there's a long wait time, stay on that waiting list, but then reach out to someone else. Sometimes you may get in to see a mental health provider and it may not be a good fit, whether that person's Black, white, or whatever. But, you know, I challenge you to just keep reaching out, explore all your options. Unfortunately, yes, you are correct. There are long wait times, but just do your research, do Google reviews. Obviously don't, you know, sign up for clinics that, you know, they have bad reviews. But yeah, unfortunately, you can't guarantee the quality of healthcare anywhere you go. You just have to jump in and keep seeking help.
Do you believe that a minority counselor or doctor is better suited to treat a minority patient?
I don't know if I'd say better suited. I'd say they're better equipped just because the culture is there. I mean, assuming that they kind of grew up in an inner city situation, which most people of color, particularly African Americans, have. I think it's important not to underestimate the understanding that really needs to be there, or ideally should be there, to really understand, you know, where that patient is coming from. What type of life does this person live? What type of neighborhoods they grew up in? What's their family situation? You know, and sometimes if you don't share that culture, you may not know. I'm not saying it's impossible, for instance, for a Caucasian to effectively treat a person of color, but there certainly will be challenges there.
Thank you. And then this was a follow-up. Do you believe the patient would respond better to treatment from a minority counselor or doctor? Sounds like you addressed it.
I mean, yeah, you know, if you have a Caucasian provider or someone who's not of your culture, I think you should give that person a chance, because sometimes they're better than nothing. You know, what if you didn't have anyone? So I think you should definitely work with that person. Feel free to educate them about your culture. Tell them the things that are important to you. But again, I'm not saying it's impossible. I'm not saying they can't be effective, but the communication, the lines of communication must be open.
Thank you, Dr. Howell. Are the common causes of mental health issues like depression and anxiety similar in white communities versus communities of color? And how about outcomes of therapies?
I think, you know, mental health conditions are equal opportunists. It doesn't just affect people of color. It doesn't just affect Caucasians. I mean, life is difficult, and mental illness affects everyone. So the literature, however, does show that people in communities of color tend to have higher rates of mental illness just because they're really, I think, just because of systemic racism. You know, they live in areas that are riddled with crime, violence, you name it, and exposure to those types of traumatic events increases the risk for the development of a mental health issue. So, so that would be the answer to that part. Now, in terms of outcomes of therapies, I think it touches on the point that was made earlier about, you know, how engaged is your therapist? How engaged are you in your treatment? So those are things that can't be always known. A person really has to go into therapy with an open mind and being willing to really participate, even if it's not an ideal mental health provider sitting in front of them, you know. But yeah, you can have great outcomes of therapy no matter what color your skin is, you know, but it's going to take more work if both people in the room maybe don't come from the same background, but you can still have great outcomes nevertheless.
How could language barriers impact receiving mental health services?
It greatly impacts receiving mental health services. I mean, I often see patients who, you know, don't speak any English, not at my current job, but at a previous job. So we actually had a kind of like a hotline that you could call anytime, day or night, and there'd be an interpreter, you know, and you could pick whatever language you wanted. Now, did that make kind of an awkward, disjointed interview? Certainly, but I guess it was better than nothing. But yes, seeking out providers who share your same ethnicity, race, language, those are obviously ideal things to do, but aren't always practical. But yes, language barriers can greatly adversely impact treatment, but most clinics have tried to address that through the interpreter services that I just mentioned.